Hi, I'm Matt Birmingham with ERA Brokers, and we're here with Tammy Hinkle with the Hinkle Health Clinic. Let's get to know her a little bit. So, Tammy, tell us a little bit about how you got into nursing and about the Hinkle Clinic here.
All right, so I grew up always wanting to be in the medical field, and then later in my life, I was able to go to nursing school here at Dixie State University, always with the intention of becoming a nurse practitioner and joining my father's practice here in St. George, who's Dr. Hinkle, doctor of osteopath. And so I finished about 2 years. I've been practicing as a nurse practitioner for 2 years. I graduated from Frontier Nursing University out in Kentucky.
Oh, fun.
Yeah.
Did you go out to Kentucky?
Twice for a week.
Okay.
So like for all of our clinical pass-offs and different things. So it's a really intense week that you just kind of lots of memorizations and passing things off.
Yeah. Well, tell us about the Hinkle Clinic here. You said a doctor of osteopathy is what Dr. Hinkle does.
Mm-hmm.
What does that entail?
So it's very similar. Doctor of osteopath is correlates with a medical doctor. They both pass the same boards and different things and have the same kind of career paths that they do. So you have your surgeons and the different things. During the medical school, osteopath school is a little bit more concentrated as far as structural and like the whole body. Mm-hmm. So looking at as a little bit more how everything plays together and how they affect each other. Not saying that there might not be medical doctors that look at that whole thing. And then they also do osteopathic manipulations. So as far as manipulation work, they not all of them do it, but my dad has always done that. And he was practiced in Michigan, where I grew up for many years, and it was just kind of discouraged with how like just traditional medicine he was seeing like wasn't being as effective as he would hope in his practice. And so when he moved out here to St. George, he wanted to have more of an integrative practice, and that is what our practice is more focused on. So it's just kind of like we do intermix both traditional and alternative medicine. So complementary is another word that people use besides integrative.
Okay. So how long have you guys lived here? You said that you moved from back east. How long have you guys been in St. George?
So they moved here in about 2002, and I came down here from Springville in 2007.
Okay. So what is the primary direction of this medical center that you have here? What are the things you guys focus on, the type of clientele that you work with?
So since we are integrative, that's who people that are interested in having alternatives in medicine and that maybe have a bad experience or with traditional medicine and are looking for other options would be, we do have these homeopathic injections as far as pain that seems really effective for people. So we have we have varied, some people are just coming to us for general family practice care, and then you have like a group of people that are coming to my dad for osteopathic treatments, and then you have the alternative, and then you have the group that are coming here as far as pain management.
Okay. And how has insurance affected the business or just working with people? I know there's a lot of different changes that happen with Medicare and having to follow Medicare guidelines. Does that affect the way that you guys do things here?
Not really.
Okay.
Yeah, it's kind of trying to do like the annual wellness exams and the different things like that. But the insurances, we don't take. So as far as like our cash pay, as far as like PHP, I think with the school system, and then IHC,
Okay.
like are two that we do not take.
Okay. And being in the real estate business, we know that a lot of things have changed with people moving to town here just in waves and waves of people. Have you seen an increase in patients, and how has that changed things for you guys here, if it has changed anything?
Right, because you just have a group of people where they're having actually a hard time finding somebody that they can come in and see without having to wait months, which, you know, is a big problem as far as like specialties, like referrals and things like that. We see that with that, like as far as some of the imaging and things done, it just seems like people are taking like a long time as far as getting into
those
appointments and
everything.
things. But as far as like affecting us, it's just, you know, obviously like just seeing more people.
Yeah, oh good. Are there any benefits to, say, the retirement population here, retiring here in St. George that you see with moving to St. George?
I think a lot of people come down because, or over, you know, as far as California, obviously we get a lot of people from California, as being, you know, more affordable there, and then obviously the warm weather. And even though, I just hear a lot that even though St. George has exploded, and you know, that just even since I think it was like 2000 where they only had like the one stoplight,
Yeah.
and but there's still kind of like a home, like a feeling of like community that people really like. I think as far as like again Dixie State University as something that brings people together, and that our community, and as far as it's really nice because there is like as far as down here that you can do a lot of active things outdoors all year round, and so that's really attractive. And I think you see that in the community. I mean, if you go on a walk, there's people biking, there's, you know, a ton of people walking, riding scooters, and you know, going rappelling and rock climbing, and so yeah, there's a lot of benefits for living in Southern Utah.
It's a real draw for people to come here versus other places. And it's not quite that big town just yet. It feels like it's getting there, but
Right.
so.
Traffic.
Yeah.
I do hear lots of complaints about traffic.
Yeah. But, you know, comparative to other places, maybe it's not so bad. Some people think this isn't traffic, but
Yeah.
so, well, we're really glad that we're able to meet and talk with you. Very thankful for you letting us come see you here, and we hope for the best. And if you have any questions, give us a call. Anyone out there, give Dr. Hinkle's office a call if you need any medical services. And once again, we're just glad that we were able to talk to you.
All right.